To think through a rescue TE exam, first we have to have a very good grasp of understanding shock physiology. So shock is defined as cellular or tissue hypoxia from reduced oxygen delivery or increased oxygen consumption or inadequate utilization. What determines oxygen delivery to the tissues? It's the cardiac output multiplied by the oxygen concentration in the blood. And when you dig deeper into the cardiac output, the components of this are multiplying the heart rate by the stroke volume. The stroke volume is the volume of blood the heart ejects, and the number of times per minute, well, that defines the cardiac output. And then teasing this out even further, what components influence stroke volume? That would be preload, contractility, and afterload. Thinking through all these components, there's an acronym PCARR: preload, contractility, afterload, rate, and rhythm. This is a more physiologic way of thinking about it than your distributive, obstructive, hypovolemic, and cardiogenic shock. In my opinion, I can use this system without memorization, and I think it creates a deeper understanding of shock and causes of shock. And I'll explain this more as we go as well.